exercise and mental health. And I never miss an excuse to promote exercise because it's the hardest thing we have to get people to do. I mean, people have unbelievable excuses for not exercising. And what do you think the most common one is? I don't have any time. And I used to be a lot nicer about this, but now I just tell people, well, you know what the reason I exercise every day? I have nothing to do. Nothing. I sit on the couch, I eat bonbons and watch TV, and the exercise is such a welcome reprieve from the sitting and doing nothing. And they go, oh, Dr. Pam, you're so funny. Yes, indeed. But seriously, you do have time to do it, and it's important to do it. Being sedentary creates all kinds of risk factors, not just for being depressed or anxious, but everything else you don't want to have happen in terms of your health. So research shows that inactivity is associated with the development of psychological disorders. Increased physical activity is associated with a lower risk of developing psychological disorder. Now, one thing that we could ask is, does being sedentary contribute to depression? Does depression cause people to become sedentary? I think it actually goes both ways. But the issue is, no matter how you got there, if you're depressed, starting to move around more is going to make a difference for you. So Robert Brown and his colleagues at the University of Virginia took 561 volunteer students. They chose to exercise or not, and then they chose how much exercise they were going to engage in. The active groups all have reduced depression scores. Students with the highest depression scores who chose to exercise 5 times a week had twice as much improvement in depression. So again, we see the same phenomenon that we saw with food, in a dose-dependent manner. You do more, you get more benefit. The worse off you are, the bigger the benefit you get. So one question that got asked in one of the panel discussions, or somebody asked it to me, is there ever a time when it's just too late? I'm so far gone, why bother? There is never a time when it's too late or you're too old or you're too far gone. It always makes a difference. And I've seen people in their 70s and 80s who have started to eat well, exercise, get hydrated, and get good therapy, and they start to open up and live life and enjoy the remaining, they extend the years they have on the planet, and they enjoy all of them a whole lot more. So it's never too late. 30 community dwelling, moderately depressed adults, randomly assigned to exercise, social support, or waitlist control. The exercise intervention, boy, it wasn't anything really big, you guys, walking 20 to 40 minutes 3 times a week for 6 weeks. It was the most effective thing for relieving depression. Participants randomized to exercising on a cycle for 30 minutes 4 times a week. Exercise or control exercise resulted in clear reduction in depression compared to controls. It was sustained at 3 months of follow-up. Now, I want to ask a question, just to take a survey of the audience. How many of you started exercising after a long time of being sedentary? Okay. How many of you hated it in the beginning? And then you stuck with it. At some point in time, you turn the corner and this starts to feel good. I actually feel better when I do it, right? That was me. I sat for the first 20 years of my adult life, which turned out to actually not be a very good plan. And then I started working out, and I hated it because everything hurt all the time, and I was no good at it. Nobody likes to do stuff they're no good at. But eventually, you turn the corner and you get to the place where, and how many of you feel this way? I feel worse when I don't exercise. If I don't move for a few days, it's like, oh my gosh, I got to get to the gym. I got to go out and run. I need to go to yoga tonight. I got to do something that will cause me to feel better, right? So anyway, we're really not talking about anything far-fetched here, and we're not talking about anything that most of you haven't experienced at some point in time. Just 30 minutes of treadmill walking for 10 days resulted in statistically significant reduction of depression on HAM-D scores. Depressed adults who engaged in 12 weeks of training versus controls, the training group had greater reductions in depression, anxiety than the controls, and the gains were maintained through 12 months of follow-up. And that's what's so significant about this, is once you change your diet, if you stick with it, once you change your exercise patterns and really start moving and you stick with it, it keeps getting better and better and better. You don't have relapses from diet and exercise. Well, unless you quit doing it, then you have a relapse. But if you stick with it. Resistance training, weightlifting, has been shown to reduce the symptoms of depression. A study comparing running and weightlifting versus control, both types of exercise reduced depression. Both groups maintained gains at follow-up. The controls got worse. So people start out in the same shape. The exercises get better. The people who sit still get worse. Running is shown to be as effective as psychotherapy in relieving depression. I subscribe to a magazine called Runner's World because I'm a runner. And one of the things I like about that magazine is the inspirational stories of people who've taken up running and what happens to them. And some of the most inspirational stories are people, particularly since this is such a big issue right now, who are they become addicted to opiates or heroin or something like that. And they all talk about how much better running has made them. And I think the first thing is if you're running and you're doing marathons or you're working out at a gym or whatever, you're hanging around with people who value health. There's some value in that. Just the company you keep does have a lot to do with this. But the other thing is when you run and exercise, your brain makes something called brain-derived neurotrophic factor. And you're wiring new pathways in your brain, literally rewiring your brain as a result of the activity that you're engaging in. 156 depressed adults randomly assigned to exercise, medication, or both for 16 weeks. Medication worked more quickly, but at 16 weeks, there was no difference between the groups. And we see this because the drug trials are so short. A lot of times it looks like drugs are really effective, but if you follow people for a long enough period of time, lifestyle changes work a whole lot better in the long term than the drugs do. And therapy works a lot better too. A 10-month follow-up, the exercise group had significantly lower rates of depression than medication or combination groups. Analysis of 30 studies showed the most important factor in efficacy of exercise for depression was the length of the exercise program. The longer you do it, the better things get. Equally effective for men and women, all ages, and for people who are severely depressed. Again, the worse off you are, the more benefit you actually gain from all of this. Exercise has been proven for both anxiety and panic disorder to be helpful. Study of 24 people with severe anxiety, randomly assigned to aerobic exercise sessions or no exercise control. Subjects in the aerobic exercise group had significantly less anxiety after exercise, no change in the controls. And many times when people are withdrawing from psych drugs or they're anxious, going out for a run or going to yoga class can lower their anxiety levels. Again, not a substitute for good therapy, an adjuvant to good therapy. So you give people more tools for helping themselves feel better. Review of 31 articles showed that regular aerobic exercise improved anxiety and panic disorder. Regular exercise lowers the level of neuroticism, anxiety, and depression. I mean, I know this about myself. You know, it's kind of interesting. Our office is a really busy place. And sometimes I'll be thinking, should I go to yoga in the morning, you know, when everything is so busy? You know what my staff says? You should go. I'll say, well, you know, we're really busy. They go, no, you go. We got it, okay? And you know why? Because they know I will be so much easier to deal with if I go to yoga or I go to the gym. So nobody in my office ever suggests that I miss a morning workout or yoga class to do work because they know that it's better if I do that. I'm calmer, I listen better, I'm easier to get along with. 4 or 5 days no exercise, I start to get a little sharper tongued, a little more impatient, don't listen so well. I mean, it even makes you better at your job when you do this. 128 men hospitalized with major depressive disorder. This is really important. Anxiety disorder, alcohol addiction, toxicomania, psychotic decompensation, and bipolar disorder. These are very sick people. Those who participated in physical exercise showed significant improvement in mental health. Patients with major depression showed the most interest in exercise and spent more time. The best results were from cycling and hard gym workouts. So exercise even helps people who are institutionalized. And of course, the sad part about it is in the institution, people don't get better food and exercise. They get more drugs, all right? So unfortunately, this doesn't carry over to institutional settings. I already mentioned that there's a big benefit for exercise in terms of recovering from addiction. And many people who are withdrawing from street drugs and opiates suffer from severe depression. So it can be a means to help people avoid relapse to going back to using drugs. The mechanism is exercise assists in the repair of some damage to the brain that results from drug and alcohol abuse. And I already mentioned this brain-derived neurotrophic factor. Some people say that this actually results in people becoming smarter over time. It's the reason I'm so smart, is all the exercise. Anyway. ADD. You know, we have an epidemic of kids with ADD, and I think what's really happened is we've taken childhood and we call it a disease now. Being a child is a disease. I mean, I remember when my sister and I were little, we used to run around the neighborhood and ride bikes and all that kinds of, we were sort of at large, you know what I mean? And my mother used to scream and holler to get us to come in for lunch, and then we go out and play and run around, and we did the same thing at my grandparents' house, and now kids are supposed to sit still and be quiet, and that doesn't really work out so well for little children. But anyway, we're drugging a lot of kids, and we probably should just get them to exercise and move around and eat some better food. and maybe some parenting and teacher help as well. But the bottom line is it doesn't shock you to find out that when energetic kids exercise, they're easier to manage. That's a newsflash, right? Is anybody shocked at that? Like, some of this is just common sense. Take kids who have a lot of energy, let them go outside and run around for an hour, and they will come in and be quieter than if you don't let them do that, right? And of course, the sad part about it is most of the physical education programs around the country are shrinking instead of expanding. And even preschool, my gosh, preschool in the United States and in a lot of westernized countries is more structured learning. I don't think I would have been so good at sitting still and learning something when I was 3 either, right? So kids should exercise. And studies continually support the idea that when kids get an opportunity to move around, you see improvements in social behavior, motor skills, strength, and neuropsychological measures, and there are no adverse side effects, okay? We never hear anybody saying, you know, since my kids started running more, bad things have happened. Has anybody ever heard that from anybody? No. All right. Yoga and mental health. Mental analysis of the studies of effect of yoga on mental health. It had a positive and measurable effect on depression, schizophrenia, ADHD, sleep. Some studies show that yoga has a similar effect on the body to antidepressants and therapy. It increases serotonin levels, lowers inflammation, reduces oxidative stress. And I am not the only person that says this. We joke about it at the yoga studio. Those of us who go to yoga often, it's one of the key reasons we're not in the asylum. Because seriously, because when things are, no matter how screwed up everything is, you go in there for 90 minutes and just focus on your practice and stretching and one thing that I'll tell you what I love about yoga is I love running because I get all my great ideas. The problem with running is I can keep thinking. But have you ever tried to stand on one leg? Well, you know, for 5 minutes, you can't really make your grocery list and think about what you're going to do at work the next day. When you do, it requires concentration, right? So it does make you mentally check out. So exercise is good for you. So here's the bottom line. It is difficult to withdraw from psychiatric drugs if you've been placed on them. And it can sometimes take a very long period of time. And this is a biological process that can be made better by a lot of things, including good therapy, a good team, taking care of yourself physically, exercise, good eating, that sort of thing. So we have created a course, Dr. Bregan and I created a course called Why and How to Withdraw from Psychiatric Drugs. It's offered through our school. It teaches health professionals how to guide patients through the process of drug withdrawal. Now we have a consumer online course available. So consumers can self-study and then set up their team and talk to their prescribers and the folks that are going to help them do this. So there is help available. There are more resources being made available. And if you're interested in that, you can contact us. We'd be happy to discuss it with you. But just in closing, you know, mental health is not based on chemical imbalances in the brain. It does have a relationship to your physical health. I mean, when you think about it, the average adult puts a ton of food through his body every year. Can you imagine putting a ton of anything through your body and it wouldn't make any difference in how you feel from the tip of your head to your toes, of course, right? That's not hard to understand. Some of this is just common sense. Exercise, humans are meant to move. This most recent sliver of civilization where we all sit all day, it's a tiny sliver. We used to have to move around just to survive. So, you know, I think the average farm worker, I read this someplace, the average farm worker 100 and some years ago used to burn like 9,000 calories a day. And the average farm wife who helped out burned 6,000. We have people right now that burn about 300 calories a day sitting, all right? So we are built to move. And when we move, we feel better. And the human body is incredibly strong. And going back to my Runner's World magazine, the other thing I like reading about is people who decide when they're 85 to run their first marathon. And then they have a good time, so they decide to run a marathon in every state. And then they're 94, and they decide they're going to run a marathon on every continent. You know, and so you really see how strong the human body is and how much it's built for doing healthy things. All right? So there's a relationship between your diet, your microbiome, your exercise patterns or lack thereof, and your mental health. So take advantage of that if you're trying to prevent psychological disorders, and certainly if you're trying to withdraw from drugs or recover from psychological disorders.